What is the normal respiratory rate for a newborn? Correct answer is option B, 30 to 60 breaths per minute. Which reflex is present at birth and typically disappears by 4 months? Correct answer is option B, Moro reflex. At what age should a child receive their first MMR vaccine? Correct answer is option C, 12 to 15 months. What is the most common cause of death in children under 1 year of age? Correct answer is option B, sudden infant death syndrome. Which growth parameter is the most sensitive indicator of acute malnutrition in a child? Correct answer is option A, weight for height. What is the normal heart rate of an infant? Correct answer is option C, 100 to 160. Which condition is characterized by a barking cough in children? Correct answer is option C, cough. When can a baby typically sit without support? Correct answer is option C, 7 months. Which of the following is a sign of dehydration in an infant? Correct answer is option C, sunken fontanelle. What is the recommended exclusive breastfeeding duration? Correct answer is option B, 6 months. Which is a priority nursing intervention for a child with a febrile seizure? Correct answer is option C, ensure airway patency. What is the primary concern for a child with diarrhea? Correct answer is option B, dehydration. At what age should a child begin to speak in 2-word sentence? Correct answer is option C, 24 months. What is the leading cause of accidental death in toddlers? Correct answer is option B, drowning. Which vitamin prevents rickets in children? Correct answer is option D, vitamin D. What is the most common chronic disease in children? Correct answer is option B, asthma. At what age should a child have their first dental visit? Correct answer is option C, 12 months. Which immunization is given at birth? Correct answer is option C, hepatitis B. Which diagnostic test is commonly used for diagnosing cystic fibrosis? Correct answer is option B, sweat chloride test. When should a child receive the first dose of Tdap vaccine? Correct answer is option B, 2 months. What is the most reliable indicator of pain in children? Correct answer is option B, facial expression. Which food is most appropriate to introduce first when starting solids? Correct answer is option C, iron fortified cereal. What is the best site for an intramuscular injection in infants under 1 year? Correct answer is option C, vastus lateralis. What condition is characterized by a strawberry tongue? Correct answer is option B, scarlet fever. Which developmental milestone is expected by 9 months? Correct answer is option B, pincer grasp. What is the best method to assess hydration status in infants? Correct answer is option B, capillary refill time. Which medication is commonly used to treat fever in children? Correct answer is option B, ibuprofen. What is the most common congenital heart defect in children? Correct answer is option B, ventricular septal defect. What is the average birth weight of a healthy newborn? Correct answer is option B, 2.5 to 4 kg. Which condition is associated with wheezing in children? Correct answer is option D, both B and C. When should a newborn pass the first meconium stool? Correct answer is option B, within 24 to 48 hours. What is the APGAR score used for? Correct answer is option C, evaluating newborn health. Which is an early sign of respiratory distress in children? Correct answer is option B, nasal flaring. Which parameter is assessed using the Denver Developmental Screening Test? Correct answer is option C, motor development. What is the daily fluid requirement for a child weighing 10 kg? Correct answer is option C. Which disease is prevented by the BCG vaccine? Correct answer is option C, tuberculosis. At what age should a child begin toilet training? Correct answer is option D, 24 to 36 months. What is a characteristic feature of Kawasaki disease? Correct answer is option B, prolonged fever. Which type of play is typical for a toddler? Correct answer is option A, parallel play. What is a sign of hypoglycemia in neonate? Correct answer is option A. What is the most common cause of anemia in children? Correct answer is option C, iron deficiency. Which pulse site is best for assessing a pulse in infants? Correct answer is option D, brachial. Which condition requires immediate intervention in a newborn? Correct answer is option B, absence of stool after 48 hours. What is the main cause of otitis media in children? Correct answer is option B, bacterial infection. When should a child receive the first dose of oral polio vaccine? Correct answer is option A, at birth. What is the term for an infant born before 37 weeks of gestation? Correct answer is option B, preterm. What is a common complication of untreated strep throat in children? Correct answer is option B, rheumatic fever. Which intervention is appropriate for a child with croup? Correct answer is option B, nebulized epinephrine. What should be monitored in a child receiving intravenous fluid? Correct answer is option C, urine output. Which of the following vaccine is given at birth? Correct answer is option C, BCG vaccine.